Image-guided surgery has become an essential tool in brain tumor surgery. The head, the skull, the skin does not show us where the tumor is. And in the old days, before image guidance, we would have to make a very large opening in surgery in order to find the tumor. With image-guided surgery, we can take that information, the MRI and the CT, and we can load it into a system very similar to the GPS system you use for your car. GPS for your car allows you to navigate around town and find a spot. With the GPS image-guided surgery, we can navigate and find the tumor. Like GPS, there are some very important components. The first part is the camera. The camera here emits an infrared light. This light shines down and reflects off these small reflective balls. This antenna is attached to the operating room table. It does not move. It serves as a reference. With that reference, we can then bring in the pointer. And the pointer, again, has these reflective balls. And so that we can point to spots on the skull, on the scalp, and that will then reference back to the camera and load in to the computer. Our image guidance system here shows different images that provide us a three-dimensional picture. So that as I bring the pointer in and the camera sees that pointer, I can find the tumor and find a path that's safe to go into the brain. That way I can make a smaller, safer opening to find the tumor and remove it. In order to use image-guided surgery in the operating room, there are several steps we go through. The first step is actually before you come to the operating room, and that's the MRI that you get to diagnose the tumor. The MRI is done ahead of time, and sometimes we'll place these little spots, what we call fiducials. These fiducials are markers that can then be seen on the MRI and can be used to register into the computer. The next step is registration. And this is the step where we're going to bring the patient to match the 3D data from the MRI. The first step in doing this is to register the fiducials, the markers that were placed at the MRI. And we do that by pointing to the fiducials with our pointer. The camera sees the pointer and the antenna and matches those in the 3D map. Another way that we register the patient is by using the surface anatomy of the skin. Using this device, the camera can see the surface anatomy. And it takes multiple spots that you can see filling up on the scan there to obtain an accurate registration. Once that registration is obtained, we can then navigate to find the tumor. Now that we've registered the patient, we can use our GPS to find the tumor. And we can navigate and map out the tumor on the scalp so that I can make the smallest opening possible. This allows me to perform my craniotomy. And nowadays I can make the smallest opening into the bone to allow me to work into the brain, find the tumor, and remove the tumor. Now here I am in surgery removing a brain tumor. I'm using the pointer to examine the edges of the tumor inside the brain. The camera sees the pointer and displays its location on the computer screen. As I move the pointer around, my position is shown by the green crosshair. And using that, I can identify the edges of the tumor. I can check and verify that I removed all of the tumor before finishing the procedure.